Hi, everybody. So it's day 7 of the 15 for this crazy coronavirus pandemic. And everybody's clamoring for more supplies, more supplies, more supplies. Did you ever really think that more supplies isn't the answer? The answer is health prevention. It's learning about health literacy, and it's also taking personal responsibility for staying home for another week and for not going out and infecting other people. And if you do go out, to be careful when you go out, to social distance, and also a few other points. I'm Pamela D. Wilson. My website is pameladwilson.com. On there, a lot of helpful information for aging adults and caregivers about health, well-being, and caregiving. In this video post in particular, there is a link to a radio show, my radio show, The Caring Generation, and it's a program from last fall about healthcare prevention, about being more educated about our health. There is a fabulous interview on there from Dr. Mayer Davidson about chronic disease and diabetes prevention. So one of the issues with this whole virus is that people who have chronic diseases are more susceptible to the virus. It impacts their health greatly. So what if we thought about this? A lot of people in the United States have chronic disease. Why don't we try to prevent that so that then if there was a virus, less people would be infected, less people would be sick? I want to read some statistics about chronic disease so I don't get them wrong. So according to the Center for Disease Control, 60% of the adults in the United States have a chronic disease. 60%, that's more than half of the population. 40% of the population have 2 or more chronic diseases. And do you wonder how that affects the healthcare system? Do you wonder how that affects healthcare spending and why healthcare is so expensive in the United States? A few more statistics. This is according to the Partnership to Fight Chronic Disease. Adults with chronic conditions are the most frequent users of healthcare in the United States. No surprise. 81% of all hospital admissions because of a chronic disease. 91% of all prescriptions filled. That's because people would rather take a prescription than change a lifestyle habit. 76% of all physician visits due to chronic disease. Over 1.1 million lives could be saved a year if we would pay more attention to chronic disease. So that's one of the solutions, is being more informed about our health, being more proactive about our health, and being willing to change some of those lifestyle habits like sitting on the couch all day, not exercising, smoking cigarettes, all the things that affect our health. That would be one thing that could solve the problem of this virus and any future virus. The other thing is, if you're going out and about, think about what you're touching with your hands. You go to fill up your car with gas. That gas pump has other people that have touched it. You push buttons on an ATM. You push buttons at the grocery store to pay for your items. Make sure you're using hand sanitizer. Wash your hands before you go to the store. Wash your hands after you come back from the store. Don't touch your hands to your face. All of these things can help prevent the stop of this virus that is driving everybody crazy right now. And that's the way to do it. It's not, we need more test kits, we need more gloves, we need more machines. If we stop it at the beginning by being healthier, by paying more attention to chronic disease, we won't end up over here where we need more supplies. It's not a supply issue. It's a health literacy issue, learning about health. There's lots of information on my website at pameladwilson.com. There's information about my radio show every week. There are over 30 podcasts that you can listen to. It's all there. We have to be willing to listen, we have to be willing to learn, and we have to be willing to change our habits. The other thing is to think about what motivates you to make a change, because making a change is hard for people. And as we can see by the young crowd still going on spring break with these viruses going on, they're not taking any of this seriously, which is a shame. If you're a parent and you have younger children, It's time to talk to them about this and talk seriously to them about this and how it could affect you if they bring this virus home. Do you want your children to bring the virus into the house? You become seriously ill. You pass it along to grandparents. It gets passed along to other people. We have to stop it at the basic level of society. So what motivates you? Is it staying healthy? Is it not harming someone else? That's where personal responsibility comes in. Everybody should take this very seriously, because honestly, we are like Dorothy in The Wizard of Oz. We're wearing the red slippers. We can go home anytime we want. We can stop this virus, but we can't stop it by continuing to go out and embracing bad health habits and doing all these things. And there's a time frame to stop it. If we don't change our habits today, in the next week, this will be another 15 days and another 15 days and another 15 days. Do we really want that? Do we really want more states to have to issue stay-at-home laws? The government's doing everything they can to solve it. The government can't solve everything. At some point, the people have to be interested and the people have to solve the issue. It's up to us. It's not up to anyone else, and it's up to us individually. Check out my website. Check out the link in this video post to an article about health prevention and patient education. My website is PamelaDWilson.com. Have a fabulous day today. Stay home, stay safe. If you're out in the workplace, stay away from other people. Wash your hands as many times as you possibly can. Have a fabulous day. I'll see you again in another video.